Thank you very much. My name is Cammie Daniello, and I am the Executive Director of the American Nurses Association, Massachusetts. ANA Mass is a constituent member association of the American Nurses Association, which advocates on behalf of the more than 5 million nurses nationwide. ANA Mass represents the interests of the Commonwealth's more than 130,000 registered nurses. We are the largest voluntary professional nursing organization in the state, with members who practice in settings ranging from acute care to community health, from the bedside to the boardroom, and as you will hear, in the operating room. Submitted prior to this hearing was a surgical smoke fact sheet, including links to the stories of two courageous women who brought their stories, two courageous nurses who brought their stories forward. And you will hear more from my colleagues today, including their personal stories on the detrimental effects surgical smoke has had on their health. More than 1/3 of U.S. states, including 4 other New England states and the entire West Coast, have now enacted legislation that requires the use of surgical smoke evacuation systems in the ORs. 9 other states are considering the legislation this year. The American Nurses Association is supporting federal legislation to eliminate surgical smoke from ORs nationwide, and I believe they have also submitted written testimony in support of this bill. I also wanted to share with you the reality of the results of a survey of Massachusetts nurses completed in April of this year. 99% of respondents indicated that their facility has smoke evacuation equipment. However, less than half, 46%, indicated that the equipment was always used. 20%, in fact, it stated that the use was only sometimes or rarely. Let me interpret this data in plain language. It's not about having the surgical smoke equipment available. It's about ensuring the equipment already present is used 100% of the time. There is no excuse for exposing patients, nurses, surgical techs, physicians, and others to the harmful chemicals and personal health risks, including transmission of viruses such as HPV, hepatitis B, HIV, and COVID. ANA Mass supports the passage of H2442 and Senate 1482, which would mandate that all hospitals and freestanding ambulatory surgical facilities adopt policies to eliminate surgical smoke.
Good afternoon, senators and representatives. My name is Megan Nolan, and I'm here on behalf of American Nurses Association of Massachusetts. We wish to express our strong support, as Cammie just shared, in support of this legislation. Surgical smoke is created when tissue is cut or cauterized during procedures. It is invisible, but it's not harmless. It contains chemicals, carbon monoxide, formaldehyde, methane, viruses, bacteria, and small particles that can penetrate deep into the lungs. So if you can smell it, which many of my colleagues have, you're breathing it in. Perioperative nurses are especially vulnerable. While a surgeon may operate once a week or twice a week, nurses are in the operating room for 40 hours a week with night and added call. Research shows that these nurses experience twice the rate of respiratory symptoms compared to other nurses in other specialties: chronic coughing, wheezing, asthma-like symptoms, sinus infections. This is not just anecdotal. While these are well documented by national organizations including CDC, NIOSH, AORN, and ANA. The evidence is clear. Surgical smoke poses a real and preventative occupational hazard. Despite this, as Cammie shared, many of our Massachusetts hospitals are not using this. The equipment exists, as she shared, in many of our hospitals. It is effective, it is affordable, it's easy to use. But without a mandate, the use remains inconsistent, and the burden falls on nurses to try to advocate for themselves, and this is not acceptable. Nurses are trained to protect our patients. We also must protect our nurses. We should not have to sacrifice our health for our own jobs. On behalf of ANA Massachusetts and thousands of nurses that we represent across the Commonwealth, we urge you to support this legislation and ensure that surgical smoke evacuation becomes standard practice across the Commonwealth. Thank you for your time.
Thank you for your time and for your work.
Thank you.
At this time, I'd like to welcome, I have Breanne Harrington from the Association of Perioperative Registered Nurses. Welcome.
Thank you for your time this morning. I am here representing AORN, which is the Association of Perioperative Nurses, as a member of their Board of Directors for Massachusetts. Approximately 90% of all surgical procedures generate the surgical smoke that was previously mentioned. An estimated 500 healthcare workers each year are exposed to surgical smoke. The average daily impact of the surgical smoke to the surgical team, which is nurses and the other healthcare providers, is the equivalent of inhaling 20 to 30 unfiltered cigarettes a day. Consider this year after year a continuous exposure while you consider your work. Surgical smoke contains hazardous chemicals, and research confirms that other viruses previously stated could be transmitted through the smoke. In addition to the danger to healthcare workers, surgical smoke can pose a threat to patients. And as nurses, it's our duty to advocate for our patients even when they're asleep during surgery. While many agencies such as OSHA and the CDC recognize the hazardous, there are no national or statewide enforceable requirements for the evacuation of surgical smoke. Many surgical facilities do evacuate some during the procedures, but it's not consistent. And many nurses have little control over whether they are assigned to a room where they're exposed to surgical smoke or not. I support this act by protecting patients and other healthcare workers from exposure to surgical smoke, as it's our duty as nurses to care for each other on the team as well as for our patients. Thank you for your time and the opportunity this afternoon to testify.
Thank you. I love that, the idea that coworkers understand a duty to care for one another. But thank you for all of your work. At this time, I would invite